Are you curious about medical hyperbaric oxygen therapy and how it might help with painful conditions? I'm your host, Dr. Tammy Penhollow, a joint spine pain specialist. Today, we're diving into this fascinating treatment. Hyperbaric oxygen therapy, or HBOT, has incredible potential, but choosing the wrong facility or physician can be risky. Join us as we speak with Dr. Carrie Bordinko, a leading expert in the field, and explore its uses in pain management and essential tips for finding the right place and the right doctor for your care. Whether you're seeking relief or just want to learn more, get ready to empower yourself with vital information. Let's get started. Dr. Bordinko, thank you so much. I've been looking forward to this for weeks, and I can't wait for you to educate the listeners and the audience about what is this amazing therapy and the really safe way to go about it. Can you start by just telling everybody a little bit about yourself, why they should even listen to you as an expert, and then maybe explain what HBOT is?
Absolutely. Well, first off, Dr. Penhollow, I want to thank you for having me on as a guest. It's a real honor to be here. And yes, I always love educating people about hyperbaric, the safety, how to use it, what's important, because I really believe in it as a medical technology that we've had for years, but we don't use it. And that's a big problem. So I'm glad we're going to have an opportunity to educate our listeners today.
Perfect. Tell us where you use medical hyperbaric oxygen therapy, a little bit about your practice.
So I work at an institution here in Paradise Valley, Arizona. We sit right on the border, actually, of Scottsdale and Paradise Valley, and it's called Benecer Health. And that was a company that I founded in 2020 after working as a concierge physician for 13 years. I saw a lot of limitations in our medical community on really helping people find new avenues of healing as you deal with every day, dealing with pain, chronic pain management issues, orthopedic injuries, spinal injuries. And it just seemed like we were just not offering real great solutions to people. So Benecer Health is really built around trying to find those, unfortunately, we use the word alternative, but real medical technologies that are not commonly made available outside of either the pro athlete recovery world or the ultra wealthy world. We wanted to bring them to the neighborhood, a facility that anyone could walk into, pick from a menu, get good physician guided direction on what would really benefit them and service our community. And so that's how I started. I am a board certified internal medicine doctor, and working through our residency program and working through our hospital training, we do not get trained in hyperbaric, though most hospitals have hyperbaric, but it's not an area in the hospital where you commonly go to or you get exposure to unless you have a patient with a burn or decompression illness. We're not in a diving community in the desert here in Arizona, so we don't see that. But it was something I became familiar with actually from the pro athlete world. And I saw how it was being used in our professional sports teams. And as someone who works with some professional sports players, it was something I became very curious about, to the point that I built Benecer Health and put hyperbaric in play for the community so that they can have a safe and physician guided experience and how to use that technology correctly.
Amazing. I'm so excited that this is something that is not just an elite athlete or something who's ultra wealthy can access. You've mentioned a couple times safe. Can you tell us what it means to undergo safe hyperbaric therapy?
Yeah, absolutely. Hyperbaric has become kind of a buzzword. We have so many different fads that come in and out of social media. So you'll see a lot of references to hyperbaric. And I think the first thing I want to really point out to the listeners is hyperbaric is a real medical tool that has a lot of evidence behind it. It's used in other countries. It's used in serious injuries. Most notably, people are familiar with Jay Leno when he had the explosion that burned his face. Jeremy Rayner, who had the injury with the snowplow. Both of them went to hospitals and received hyperbaric in order to save their lives. So it's a real technology that is used every day, but it's not used every day out in the community for people to have the ability to heal themselves quicker using that technology or to prevent aging. Anti-aging is a wonderful tool for it as well. But safety is where the community becomes a problem. In the hospitals, we have rules, regulations, fire code, all these ways that we make sure that whenever you're using the real hyperbaric technology, which can be dangerous, that it's always safety mitigated. But in the community, that doesn't always, those boxes don't always get checked, and there's no one policing the safety factor. So, what has happened in the national way that hyperbaric has been delivered, because people are asking for it, is they deliver a form of oxygen therapy that is not truly the standard of hyperbaric. So, what I guess I'm trying to say in that is you don't actually get the results of hyperbaric, although it may be labeled hyperbaric. So, those of us who are more trained in the industry, come from a medical background, we use the word fake hyperbaric because it kind of explains what we're trying to say to the consumer. So, when you're getting into a chamber that does not operate under the principles of real hyperbaric, and I'm going to line those out for you real quick, that means you are in a compression device or pressurized device that has the ability to exceed 1.4 atmospheres of pressure. So that's not going to mean a lot, but it is the degree of pressure that can safely be inflicted on the human body above that, to where the pressure actually shifts the amount of oxygen that is put into your bloodstream. That's where hyperbaric comes from. The second criteria is you must be exposed to 100% oxygen. And I think most people remember back from their biology classes in 8th grade that we breathe 21% oxygen. So obviously we're giving you a much higher concentration than room air. Those two criteria have to be met. But here's the warning side on safety. This is why you're asking the question. If I put someone in 100% oxygen, which is a flammable gas, and I put them under pressure, and I don't follow safety rules like cell phones and batteries, then those two things explode and we have a big problem. So when you're in a chamber and you have a friend who's on TikTok or on Instagram and they're taking a picture and they're going, look at me in my chamber, and they're on a phone, they're not actually in a real hyperbaric chamber, because that chamber and that cell phone would have exploded. So realizing how to determine if you're getting efficacious or effective hyperbaric, real hyperbaric, and not, can be as simple as saying, do they screen you for taking any devices into that chamber? Something as simple. We have people all the time that show up and go, well, I know I can't have a phone in there, so I brought a good book to read. And I go, well, paper catches on fire too. So you can't take a paper book in there either. You can't take anything into a real hyperbaric chamber. It has to be a controlled environment, because that is a safe environment. None of us want to have any harm to anybody in the chamber, in the room, in the building. And unfortunately, there have been some less than fortunate people who have had experiences in chambers where they have been harmed. But safety is paramount to us at Benesair, and we make sure that that criteria is always assessed over and over. We do safety drills and fire drills all the time to make sure people are safe. But getting real hyperbaric, those are the things you have to watch out for.
That's a big deal. And this is like a spotlight on fake, real and fake. What are some of the other things that are real about what's going on there? I would imagine that you would want to have this huge checklist of who is even safe to go into the chamber, and have a physician, a real physician that does some form of extensive medical history and exam and then monitoring throughout. Can you kind of walk us through what a treatment session would look like with you?
Absolutely. So you led me right into it. I mean, if you're going to put somebody in a vehicle, if you want to think of it as a container that the person is going in under pressure with 100% oxygen to get that critical healing that they're looking for, there's obviously a potential downside and safety risk. So not everybody gets to go in the chamber that shows up. You can't just pop in and go, sometimes doctors will send them to us and they don't know the correct screening safety. And they'll say, put my patient in, and I'll have to pick up the phone and I'll call that doctor. And I said, I did their physician clearance. I did their safety. And I'm sorry, but we would hurt that person if we put them in. They're not safe to be there. And that's an education opportunity for me to tell them what are the reasons why people can't go in. So certain trauma to the lungs, certain asthma, uncontrolled asthma, certain cardiac functions, or recent chemotherapies I can make the person much more ill by putting them under pressure than not. If you're going in a fake chamber and you're not really under pressure, doesn't really matter. No one screens you. But when you're putting people in this level of medical treatment device, there needs to be 100% of the time a physician on site. Even the best screenings, we're humans, things go wrong. We don't always get maybe all the information. We have to pull that person out. We need to be medically able to take care of them or get them to a safe environment or get them controlled or stabilized when we pull them out. So always 100% has to be a medical doctor in the building. We don't have to be in the chamber room, but a few feet away where we can supervise and guide that care at all times. And then that safety screening, you're right. There's a list of what we know leads to potential complications. So we open up that discussion. We don't always have their full medical history. So we ask them prompting questions to understand their lung capacity, to understand their cardiovascular capacity, neurotrauma, seizures, all those things. That process takes almost a half an hour to safely put somebody in that position where we know that all we're going to do is bring them benefit and no harm.
Oh my goodness. I love that. So say they've passed the safety screening, they are a good candidate. What are some of the things that you see people come into your chambers at Benacer for the most part, maybe a rank order? And then if we can talk a little bit about what a treatment session or series of sessions would be.
So over the last 4 years that we've been operating Benacer, and we're about ready, we're going to be opening up our second location, which will actually have a larger hyperbaric center. It changes. The population changes. Who's in town in August in Arizona, who's in town in January changes. So we see a sliding utilization, but I'll talk to you about like the top 3 indications of who comes in. So very commonly, as you can imagine, it's a sports or orthopedic injury. That's your space. You're very familiar with it. So maybe they've just had a regenerative product. They've had done an injection with prolotherapy or PRP or amniotic cells. There's a lot of great evidence in the literature from just US and outside of US on how hyperbaric can augment the products that you will use on someone to help them with pain relief or to repair tendon ligament injuries. So we get a lot of that. That's very common. We also get a lot of plastic surgery recovery. And I believe that's because plastic surgeons are a little ahead of the rest of us doctors, honestly. They had done some very large trials in the 90s showing that if they did a large surgery on someone and they put them in the hyperbaric chamber in the hospital, that it completely changed that recovery time. And it's not just about how quick did my sutures heal and when did I get my drains out or what did my bruising look like. Actually, what happens when you're not traumatically healing from a surgery, you don't lay down as much scar tissue. So the actual outcomes are different. People have better scar appearance. They have less keloid formation, which is that gnarly scar nobody wants to have form. They do get back to mobility. And the biggest caveat, my favorite caveat of dealing with surgical cases, is that they come off opiates quick. And I think that's a win for everybody, right? It's a win for the patient and the complications of opiates. The surgeon's very happy because they don't want them on that type of medication. And the patients don't have the side effects of the opiate use, which is the constipation and the nausea. So a lot of times we can take a post-op case like a knee replacement, which is a big deal. And really within 2 days, we can get them off narcotics because the pain is addressed through hyperbaric, through the pressure and the oxygen saturation. We accelerate the healing and we decrease the edema and the negative chemicals that go into that joint space, which cause a lot of the pain. We can have them transitioned off. And the average knee replacement is probably on opiates up to 14 days. That's a really quick turnaround. And then the third one that I want to address is really more of what I'm going to call the prevention care crew. Some people call it anti-aging. But for those of us who are working hard to do all the right lifestyle choices, we're following our sleep, we're eating right, we're exercising, we use mobility. Adding hyperbaric in is part of our recovery as we age to kind of reset the cellular health and allow us to keep pushing our bodies and staying active is a great way to use the technology. And that's probably about 40% of the population that comes into Benacer.
Wow. I love that. And I'm so glad that you touched on the post-operative because many patients, even in a regenerative clinic like I have, we're doing prehab to increase the healing that they have using their own cells. But some people do go on to surgery. Some people get that joint replacement or they have the meniscal repair or the ACL repair, the shoulder repairs. And just to know that they can get back to the activities they love faster when we do this 1 + 1 = 4 or 5 or 6. There are a lot of things that we can do in concert. Can you give an idea of what maybe a prescription for hyperbaric would look like with regard to 1 session, 20 sessions?
Yes, absolutely. So once again, because we run medical hospital grade hyperbarics, we do have prescriptions because that's why you see a doctor. That's why you allow me to take my expertise and allow you to understand what's going to get you the farthest. And so part of it is concrete. It's this much depth. It's this many times, but a lot of it is subjective too. Everybody's going to be, all comers are going to come in at different stages of injury, right? So it's not that hardcore. But mostly what we're dealing with are most people will come in, and if they're post-operative healing, I'm going to take wellness and put it in a different bucket because that's a different journey. But if they're coming in from any post-operative or injury state, we're going to take them to about 47 feet, which we also call 2.4 atmospheres. And the reason why we do it, it's not random, but most of our controlled trials that have been done showing wound healing, scar formation, pain control, pain results, all have come out of trialing different depths, that 47 feet, and figuring out which one got us the right response without causing additional potential harm. So that's where we'll go. And the vast majority of people, if we have the opportunity to get a hold of them before they go into surgery, we will really encourage them to come in the day before surgery and do one treatment. We call them dives. That's the kind of the lingo that we use. So we'll say, come in and do your first dive before surgery. There's nothing worse than going through a traumatic surgery. You're trying to recover from anesthesia. You feel nauseous. You haven't eaten in a day and a half. And we throw you in a chamber and you're like, oh, here I go again. You need to know what that experience of hyperbaric feels like before your body's in that trauma. So we have you come in first. It serves two roles. First off, you get acclimated in what is ahead of you, but also it actually helps the surgeons. I get a lot of surgeons who don't know this. And then they call me after they've had a patient who did hyperbaric the day before surgery. And they go, you won't believe this. There was less blood in the field. I could see everything better. The tissues were more viable. The stitching was easier. I'm like, "Mhm. Yep, know all that." And they're like, wow, I had no idea. So we do one before, and then we try and get you immediately post-op. And people say, you mean 2 or 3 days? And I go, no, immediately post-op, like an hour. They wheel you out of the procedure. They stabilize you in the recovery. It depends if we have a surgery center up above us. So they really wheel them right down about 2 hours after surgery. Or if they're coming from a nearby location, their loved one puts them in the car, brings them directly over here. They're groggy. They don't want to be here. But we safely get them into the chamber, get them comfortable, adjust their drains, make sure their vital signs are stable. And then we'll put them in for about 2 hours immediately afterwards. So we do a longer session if it's same day as surgery, because what we're trying to do is really cleanse the body. We're trying to push that general anesthesia out, which leads to less vomiting, upset stomach, complications. Obviously, they're more alert. They're more aware of what they need to watch for. And it also gets that immediate pain level down. That's the win. That's the win for the patient. They come out, they're like, I went in, I was so out of it. I felt horrible. I actually feel almost human right now. And I love hearing that from people. So we'll do that immediate same day. And then depending on the extent of the surgery and the amount of damage, you're really looking at somewhere around 3 treatments, probably post-op, all the way up to, we have some extreme large cases where they may come in for a total of 2 weeks. If it's been a big abdominal wound where there's a lot of skin that's been disrupted, or it's an extensive facelift with a lot of laser resurfacing, they kind of like to get all the way back to normal as quick as they can. So we may see them for up to 2 weeks. When the surgeon has said, look, you're not going to look normal, feel normal for 4 weeks, we can cut that in half most of the time. But that's really a big portion of that is that communication with us as the physicians, myself and Dr. Chaudhry that's here. We're constantly checking on them. We're popping in the room because, like I said, we're always on site, or the hyperbaric chambers aren't running, and we do run 13 hours a day. But we're popping in the room. We're looking at them 2 or 3 days between treatments, and we're going, hey, you're coming along really great. You don't need to come again. You're on the road to recovery. If you want to keep coming, we're happy to support you and help you. But everything's going to go smooth from here, and we leave it up to them.
Wow. My wheels are turning as an anesthesiologist, wondering, would there be utility ultimately in some future ideal situation where any person who's undergone anesthesia, IVs are pulled, everything's ready, you can go directly into a chamber and dive? It just sounds like the ultimate way of putting a person on a very, very happy path to recovery.
I agree. I mean, in a perfect world, right? We all have our medical utopias that we think about. And I agree. If there were enough chambers in the world and there were enough doctors to supervise it and meet with the patients, it would be a phenomenal way. But the reality is, in healthcare today, a lot of us have the ability to kind of direct what our outcomes are, right? The system tells us things, but we have an ability to make some pivots on our own choices and be educated consumers and be our own advocates. And I think that those are the ways that we can say, I do have patients who maybe come in because the very first time 4 years ago, their orthopedic surgeon said, I'm going to do a rotator cuff repair. I really want you to have hyperbaric. I believe in it. I've seen the results. My clients have spoke to me about it, and they come in and literally every surgery they've had to have afterwards, they pick up the phone and they call us and they say, well, the doctor I'm seeing now doesn't know what I'm talking about when I mention hyperbaric, but I know what it does. So here's my surgery date. I'm coming in. I'm seeing you for one treatment before. How many do I need after? And they're repeat users. So the patients can be their own strongest advocate.
They sure can. You said that you may not feel awesome with your first treatment. Can you, I'm sure you've dived before. What does it feel like to be in the chamber?
I like to collect data from people. So commonly I'll go after someone's had their first experience. I'll say, what do you notice? What's different for you? And I get a wide range of feedback, but I mean, I think I can put it in two categories for you. Some people come out and they will say, I absolutely was at the most calm state of mind I've been in years. I just felt overwhelming zen. I didn't want to go to sleep. I don't feel tired. I just feel at absolute peace. And I said, yeah, I think it's something to do with the 100% oxygen. I think it just calms the brain. The brain uses oxygen as its food source, as we know. It uses glucose too. The brain is the main consumption of oxygen in our body. So it loves it when you give it to it. And so I think it finds its happy place. And people just come out and they go, I feel at peace. I feel wonderful. I feel like I could go conquer the world or solve all these big problems. So that's common. The other half of the coin is people come out and you come out on a gurney and they kind of springboard off the gurney. And they're like, I need to go run or do a workout. And I'm like, oh, you didn't work out today? Like, no, I already worked out an hour today, but I want to go do it again. I have so much energy. I feel like a ping pong ball. I'm just bouncing off walls. So you get one or the other. I tend to be the energy person. So I go into hyperbaric after I do a nice hard workout. I come out and I go, oh, let's go do it again. It was fun. But one or the other, it's positive. I think very few people come out of a hyperbaric experience. Let's just take out the ones that are recovering from surgery. That's different, but nothing's wrong. You go in, what am I going to experience? You're clearing your ears. You're feeling the pressurization through your station tubes. So you need to pop your ears. That's the only thing you notice. There's no pressure to your body or chest. People think, oh, I'm at 2.5 atmospheres of pressure. I'm going to feel like an elephant sitting on me. None of that's going to happen. But when they come out, I think most of them say, I did notice something happened to my body. I don't know if I've ever had anybody come out that said, don't really think anything happened. I mean, there's some experience they're feeling and they notice they were in it. We have a really great way of helping to educate people as well, just on going into the chamber. What should you feel? Like popping the ears is one example. But you can always test when you're in a real hyperbaric chamber by assessing a couple things that you can't fake. And this is what I love. When you go in a real chamber, first off, we talked about no cell phones, no Oura rings, no Whoop watches, no battery operated devices, no paper. So that's first and foremost. But let's pretend they do all those things and you're still not getting hyperbaric. When you lay in the chamber, when you're first in there, the disassociation or displacement of gases. So we talked about oxygen being 21% at room air. And when we open the chamber door, obviously it's at room air. We're going to have to displace that nitrogen and oxygen mix, and we're going to bring real 100% oxygen in. That causes a molecular displacement. If anybody goes back to their biochem days, they'll know this. And it warms up the room because those molecules are hitting each other. So it gets about 20 degrees hotter than it was before we closed the door. So it feels like a little bit of heaters on. And you get that for about 10 minutes while we're displacing the air to get you to depth. And then it normalizes out to what you were used to. And then when we go to bring you back up to surface, as we call it, because we took you to a depth and now we're bringing you back up to ground level, it gets ice cold. Think of yourself walking to the freezer, opening up the door and standing in front of it for a few minutes. And there's this cold wave that hits you that you're like, whoa, so much that we give people blankets because they need to actually pull them up around their face. Like, it's cold in here. That can't happen unless you put oxygen in a chamber. So it's a great way. We've had so many people, these 20, 30 treatments or dives somewhere else, and they come in, they go, yeah, that doesn't happen in that chamber. I go, that's because there was no oxygen in the chamber. So it wouldn't happen. You were put to pressure with air, not oxygen. And hyperbaric doesn't heal unless you have the combination, like we talked about earlier, of the combination two things. Yeah, the pressure and the oxygen must both exist in order for healing to happen.
Whew. Wow. It's exciting. And I love that you're kind of putting these pearls out of even if there's potentially pressure, they're not getting the oxygen fake, or they're not getting either fake. So I love that. Thank you so much for diving into that literally. Do you know of anything because of the dissociation that you talk about with the euphoria, the kind of the 100% oxygen brain? Have there been studies, or are there people working on the psychiatry level and potentially doing breakthrough therapy, regression therapy, something with PTSD, something with hyperbaric therapy and psychoses?
Oh, absolutely. And if I can just give a little support to some not for profits that are out there really trying to raise awareness on how to use real hyperbaric chambers and heal those with traumatic brain. I think we can all understand that we have a lot of war vets that come back home. Obviously, just 20 plus years of Middle Eastern war has left a lot of disabled soldiers out there, and a lot of them with some sort of brain trauma, either TBIs from IED explosions or impact trauma or PTSD, just from being in the different areas that they've had to be deployed to. So we have that under research through an organization out of Washington called treatnow.org, which is probably the largest national one we have, that is funding different studies around the country in different cities and large medical institutions like your Walter Reed and your VA systems to say we have a high suicide rate, which is like to the PTSD. And is there a role for hyperbaric to heal the brain? Because we talked about it. The brain thrives with the oxygen. And if you have brain trauma and you have those cells, which are very slow to ever heal or turn over, which they really don't do much of, can we use oxygen as a healing tool for them? So yes, there's a lot of nationally funded studies out there. We have great data coming back. The NFL has recently jumped on board with funding called Plan 88, which is also supporting a lot of our post-NFL concussion injuries or CTE and Parkinson's injuries, which I think a lot of people in the U.S. are aware of and what we've seen happen. I would say Joe Namath was great quarterback. Everybody knows who he is. You don't even have to be young and you still know the stories of Joe Namath. And in his 80s, with the degree of disability that he had encountered, not only orthopedically, spinal trauma, shoulder trauma, I mean, everything, right? But really the most debilitating to him was the brain trauma that he was suffering from. And he really piloted a program, probably, I might be off on the years, 5 or 6 years ago, where he did 80 hyperbaric treatments at a medical center in Florida at a hospital. And said, what am I able to do? When he went into those medical treatments, he wasn't able to answer the question, what is your name? Where do you live? He was having problems with balance and gait and walking. And what happened after 80 treatments was he was interviewed and he was able to answer complex questions and situations. It was reported that his personality was back to the old Joe. He was able to have motor function within his body that was restored because the brain healed with those treatments. And based on that information, he put together a charitable network to help other NFL players who had also suffered massive concussions to go into these different trials and help. So yeah, we have great published data out there. The problem is with all the published data, I think a lot of people and consumers still ask, well, when can I get it and when will my insurance pay for it? Because we have published data. The reality is that ship's not going to sail. I mean, we're not going to see that probably in my lifetime, where even though we know it works, even though we can prove it over and over with tens of thousands of patients that something works, this is not going to be an insurance-funded benefit for people. This is a slice of the pie that you have to say, my body is worth everything. It's priceless. It's the best asset of what I have besides everything else. So if I want it to be treated the best, I'm going to have to set out and fund that myself. And I think that's we get a lot of calls and questions. This injury, that injury, my friend went there, they got better. Can I do it? And can I get reimbursed by my insurance? And it's a tough conversation because we always have to try in a very short amount of time on a phone call, educate someone that no matter what their injury is and how catastrophic it is and how much we know that hyperbaric will fix it, insurance companies are not going to reimburse them for what happens. And that's the sad part.
It is, particularly when it can be so life-changing. I walked the same exact path with regenerative therapies using the body's own blood, bone marrow, or adipose in their regenerative therapies. And we have to have the same exact conversations. And you don't want to start me down the diatribe on insurance and third party and all these middle people, but it really is sad. I do think that when people get to a point that they recognize that they are in charge of their health, and that is true wealth, is their own health and the ability to do the activities, not only that the things they dream of doing, but just the everyday functions, that it's something like a switch goes off in a realization of I am actually empowered. I'm in control of this. I don't have to wait for somebody to go through prior authorization and decline and re-prior authorization and decline. I can just take care of it right now. And isn't that empowering?
Or go through useless therapies that they're instructed to jump through these hoops. And we know as trained medical doctors that that's not the order of healing and repair. That's someone's mantra of we want to see how many hoops you will jump through before we might have to cave and say yes. And so I know we both educate our clients and going, yes, I understand if you do these things, there's a chance of being reimbursed, but please do understand that would not be the way I would order or prescribe it for you to get you to your goals the quickest. So we need to step back and evaluate what we're choosing to do.
Absolutely. I'm so glad that we touched on the organizations that are funding a lot of this information. As a 12-year Navy veteran myself, completely active right after we took Fallujah and was at Walter Reed National Naval Medical Center. My veteran brothers and sisters are actually benefiting from things that we do, both of our businesses do.
Absolutely.
And it's wonderful. I appreciate you mentioning that. I hadn't even put that on our list of things to talk about. Dr. Bordinko, are there other things that you and I should bring out to the listeners and say, look, we've talked about pain issues, we've talked about even brain issues and some longevity things. Are there other things I've missed, other things that you want to kind of bring back to the forefront or even summarize?
Well, yeah, I'll kind of answer that in a little bit of a roundabout way. So obviously we talk about pain and injury because that affects everybody. We're talking from 12 to 100, right? I mean, in age brackets, everybody ends up getting kind of an orthopedic injury or uneventful surgery recovery. So I think we've given a lot of options out there for just the everyday consumer to think about this. But let's just talk about some of the other things that we do as board certified medical doctors that we believe in that are not really supported by our insurance or mainstream colleagues. And it's not that even our colleagues don't necessarily believe in what we do sometimes in the regenerative space or in the hyperbaric space. They just very honestly say, I don't have time in my 7-minute visit under insurance to educate my wonderful clients about the fact that there's other things they can do for themselves. So I think we should spend just a minute talking about some of those other great modalities that we both believe in that kind of bring this full circle and create a complex healing and recovery space. So obviously starting with you in the regenerative space and working with those musculoskeletal and orthopedic ailments and saying, look, there's options before surgery or around to avoid surgery completely, which is actually the great win when we can get it. And then for us on the recovery side, we've talked about hyperbaric and the healing properties there, but also at Benicera, we offer low-level laser light therapy. Some people call them red light therapies. Very well studied. Mostly Dr. Hamlin out of Yale is kind of the pioneer in that space. And even though he's from a large academic institution, it's not supported by insurance or mainstream medicine. A lot of people have heard of using these red lasers, and a lot of offices do have them, especially in the regenerative space as well. And light therapy, I just give a really simple explanation if I could just have a minute to do that, to talk to people, because when you approach someone and say, I'm going to put you in this light bed, we have a full size bed that you lay in with 2 panels of light. We don't have the little hand wand ones. We used to start with that. Now we've invested in the full immersion of light. And they say, come on, doc, seriously, you're putting me in a light bed? How on earth is that going to work? And I say, I want you to think about it like a pharmaceutical. When you are hurting somewhere, and you go to the cabinet and you say, I'm going to pop this drug out. Let's just call it Advil or ibuprofen, and you take it. And 15 minutes later, I say, well, are you still having the back pain or the knee pain? They go, no, it's all better. The Advil fixed it. The chemical fixed it. Then I remind them of going back to their science days and understand that different wavelengths of light are chemicals. They create the same exact chemical process that Advil or ibuprofen created. It's just not a pill. So when you lay in a light bed and you go in, and I've actually had a couple surgeons come to me because you guys are always like leaning over tables and getting back pain and shoulder pain. And they're like, I just can't get past this. Everything's hurting. And I throw them into our photobiomodulation bed, which is the real medical name for it, but they call it the light bed. And they come out 15 minutes later and they're like, that's not possible, because I went in hurting and I came out not hurting. And I said, look, light is a chemical, no different than a pharmaceutical drug, but doesn't have the side effect profile of that. You don't have to worry about the gastroenteritis and all the other problems with using chemicals, but it heals in the exact same way. It literally penetrates the cells, turns on a process of healing and recovery, and gets you out of that condition. So I'm a huge believer in the integration between using medical grade light therapy, and we're not going to get in, the podcast would be too long to get into the whole fake light and real light, but using a real medical certified photobiomodulation bed and using it in conjunction with hyperbaric chambers. And we've looked around the country. We've been trying to find studies showing that synergy, because you said before 1 + 1 = 4. I agree with that. The sum of the two together far exceeds the individual components of using those two technologies. So when we partner them together, we notice an increased level of healing, wellness, and especially in the pain management aspect. Getting people off of medications that don't really do anything to treat or recover them why they have pain. They just mask pain because we don't have a better tool in our toolbox. That is a huge win for us in our center and being able to help that. So when you get into these chronic pain conditions, putting those two together, I've seen some great success stories. I wish there were more centers around the country that partnered them together, but it just doesn't seem to be right now the landscape out there.
That's a truly holistic approach. And I know that other things that you do at the center include a lot of body work with massage, with physical therapists, with personal trainers. It's all about this multiple avenues of looking at a problem, whether that be longevity or an injury. And it fits absolutely with my model, particularly as an osteopath, the holistic approach and what I do in my practice. So I just appreciate so much that our community members have this available to them.
Absolutely. Yeah, we have a lot. It's a lot to take in when you walk through the door, but we always welcome anyone to stop by Benesair Health, where we open at 6 a.m. in the morning. We're here till 6 p.m. at night. We're here 6 days a week. So we try and make our scheduling very flexible. People have jobs, they have responsibilities, they got to get their kids to different things. So we try and have hours, unlike our regular medical system that's very locked and it's hard for people to get what they need. We try and have that availability out there, so that you can actually access what you need by having those extended hours. But you can always come in the door and you'll be greeted with a big smile, and we'll be happy to give you a tour and discuss your unique needs and what would work for you. There's no membership at Benesair Health. It's open to the community, and it's an a la carte menu. So you come in and we'll tell you what each service costs for pricing. We'll try and give you guidance to help you. We'll partner with your physician that's sending you over. If your doctor's involved in that decision making, we're more than happy to share the medical information with them, send them our progress notes, anything we can do to facilitate good kind of support of the healthcare goals.
Well, it's true collaboration, and it doesn't feel like you've sent somebody somewhere and you have no idea what happens. You have no idea where they're at on their process and then how it's going to fit back in with your program with them. So I love that you collaborate as well.
Yes.
Dr. Bordinko, how do people find you? I know that we've talked about Benesair specifically. Are there some socials that we'll link to in the show notes, of course, but how can they follow you on the social media as well as to get into Benacer?
Absolutely. Well, of course, we have a wonderful website that I'd like to think is dual purpose to kind of give you a tour if you don't have the time to come in, but really have a lot of supporting videos to help educate the consumers and on things that they can look for or use our facility for. So that's simply found at benacer.com, and that's BENESSAIR.com. We also are on Instagram. We post a lot of informational video on there. That's our handle is Benacer as well, and Facebook.
Wonderful. I thank you so much for sharing your time and your expertise. I hope that everybody has gotten how important it is to actually have real hyperbarics and real photobiomodulation. We might need to come back for a second take on this just to talk about photobiomodulation, but thank you so much for your time. And please like, subscribe. And if you've got any questions, please leave them in the comments. And if they're for Dr. B, then I will forward them to her and we'll get you some answered.
Absolutely. Thank you, Dr. Penhollow.
Take care.
If you have knee pain and would like to learn more, I have a worksheet called 5 Things to Do Now to Reduce Your Knee Pain Within a Week. Go to www.kneeboostnow.com to download it for free. I'd love to hear from you, so please like, subscribe, and comment below so I can help you get out of your knee pain.